The fight against the Zika virus continues tonight as many families finalize their spring break and summer travel plans. The Centers for Disease Control is finalizing a Zika test, but it needs local labs to help test it out. Tonight, only on 3, we're taking you inside the Omaha laboratory, helping the government test and track Zika. The potential for a public health crisis looms as spring and summer travel ramps up.
We got to get the public health laboratories up and running. And, possibly we need to get a commercial kit out there that other laboratories can use as well.
Dr. Peter Iwin runs the Nebraska Public Health Laboratory at UNMC.
We could test them a year later and say, yeah, you had Zika back a year ago.
So you can look for the foot, which is the actual virus, or you could look for footprints, which is evidence they were there.
Very good analogy.
Iwin and his staff are helping the CDC finalize a process to test blood specifically for Zika virus. And the faster, the better, because government labs are swamped with cases.
To get results back from the CDC takes days to weeks. It's not very good for patient care when you have to wait so long.
That backlog could get worse. As people travel for spring break and summer vacation, Omaha travel agent Laura Dennis says many people are not canceling their trip to the tropics.
It's still been Mexico, really and truly, and some Florida.
Zika isn't fatal, but can cause birth defects, and couples expecting a child or planning to become pregnant are encouraged to cancel their plans, which means honeymooners are looking elsewhere.
I do think that you're going to have some people who just aren't even calling in to ask for those destinations because of their concerns.
Health officials are preparing for another influx of potential Zika cases connected with the Olympics in Rio de Janeiro, Brazil this summer. They're working hard to have tests in place, ready for when travelers return from Brazil.
The timing couldn't be any worse, I don't think.
There haven't been any reports of new cases of Zika in the area since local health officials announced 2 women who recently returned from Central America to the metro had contracted the virus.